Hi, I'm Dr. Alex Hughes. I am an alumnus of GBSH MBA Health. I'm currently working as both a doctor but also a clinical product manager at a health tech startup based in London. I think it was very much working in frontline medicine in the NHS through COVID. It was a very powerful experience. I learnt a lot, but I also kind of felt a sense of powerlessness that can, I think, stem from a lack of understanding or lack of a full understanding of the health system and the structures surrounding me. And I wanted to empower myself, and so I started looking at health management programs. That led me to looking into MBAs. Neither were quite right for me, and then I found the GBSH MBA Health, and it just felt right. It was the right compromise between business and health. You know, I've gone from being purely clinical to, through the MBA Health, kind of being empowered to reach out and connect with a health tech startup, where I went on to do my MBA summer project, which was a fantastic experience, the consulting project. And, you know, it was through that I got to know them and that I was given a job offer. So I think, you know, kind of my trajectory has been very significantly impacted by the MBA Health and kind of the experiences that I've had through the programme. So I think kind of even pre-March 2020, the health system was in distress. It was very much a system in kind of near continuous crisis, and that's obviously been made much worse, and it continues to go on, you know, with health struggles of our population, the struggling health system, and compounded by the workforce issues. You know, we're currently in the middle of a doctor strike, I think last day today, and I think the health system needs to evolve, and in my mind, probably the things that are going to do that are firstly innovation, but not just kind of tech innovation, which I think is the thing that comes to mind, but also kind of innovation in the way that things are done in processes. And I think particularly of our trip that we had on the MBA Health programme to Moorfields Outpatients in East London, and just seeing how kind of an innovative approach to just rethinking that the way that the space was designed, the positioning of people and technology, how that increased efficiency so significantly, I think is a really important lesson. So I think innovation is how it's going to evolve. I think the other way that the health system is going to evolve, I think, is we realise the huge impact that policies have and policymakers have on the health and well-being of our population and the way that our health system is designed and can cope with stress. And I think that hopefully kind of seeing change in that space, concerted effort in that space will have an impact on what is happening. And in answer to the second part of your question, how will MBA Health graduates contribute to that? I think what's nice about us is we have a breadth to us that comes from doing kind of all of the traditional subjects of an MBA, but I think we also come with a different background and a different perspective and probably a different set of values. And I think that approach, you know, we understand that the health sector is a unique sector, and it requires thinking about more than just, obviously it's important, just increasing dividends for shareholders. We need to think about patients and outcomes, and, you know, value-based healthcare. The UCL MBA Health has the breadth of an MBA, but with the focus of health all the way through it. You know, it's the core theme. All of the case studies are health focused. All of the kind of, you have access to amazing health executives and residents. I really liked how each module was led by both an academic who specialised in the area, but also an executive who worked in the health sector. So health strategy was taught by a health strategy consultant as well as a UCL academic. I think the MBA Health really kind of brought me from having kind of quite an on-the-ground, granular understanding of health systems to having much more kind of a bigger picture understanding. And I think thinking, you know, going right to the beginning, thinking about our finance module, our health economics module, our policy modules, all the way through to our health system modules, I really kind of developed quite a strong understanding of, you know, the incredible influence of economics, of policy, of culture on the challenges that populations face when it comes to their health. But not only that, how those three things also influence the way that our health systems are designed, and the way that the health systems cope with stress and respond to health challenges. And that all culminated obviously in our global health challenge to Egypt, where we kind of saw that in play.